Hi, it's Jessica DeMassa with WTF Health. I'm here at the HISA studio at HIC 2019, and joining me right now I have Gillian Mason. She's a patient advocate, so we get to talk patient advocacy issues. She's also a physio-rehabilitation researcher at the University of Newcastle. So, Gillian, great to have you with us.
Thank you for having me.
Okay, so I'm really inspired, I think, by talking to patient advocates because of the fact that it's like stories from the front lines of the healthcare system, but from like the opposite perspective. So, for those who are not familiar with kind of the Australian healthcare system, and even I guess those who are, explain to us what it's like to be a patient with, you've got not one but two relatively rare conditions, and you're navigating the healthcare system. What's it like as a patient here?
Look, it's both great because there's really good quality healthcare in Australia generally, but it's very complicated and it's very difficult to feel like your needs being met when there's just so many things going on.
So what's important as far as like what clinicians need to know, or like the health informatics community who's working on building better systems to make things less complicated and confusing when there's so much going on and you just don't feel well? What do they need to know about how to better design those systems so that they are compassionate or kind or easier to just navigate and understand from the patient perspective?
Well, they need to know to show us that they value us, actually, because the problems that we present with, they're complex. When there's a couple of different health conditions going on, it's really easy to feel as a patient like you're a burden. And we use that language in health research and in designing health services. You know, we're trying to reduce the burden of stroke, for example, or, very expensive disease. But people with stroke have skills and experiences, and they're human beings like the rest of us who deserve us to treat them with respect.
One of the things that really struck me, you spoke here at HIC, and one of the things that struck me in your presentation was how you quantified the amount of time that you have spent taking care of your chronic condition, your rare chronic condition. You have a pair of them, you said. That's unusual. The time you spent taking care of that, and also just like transporting yourself to and from appointments and things like that. So talk to me a little bit about that pie chart that you created.
Yeah, so I made a pie chart that was having a look at a review of my personal diary with all my health appointments and then other things that I'm supposed to do to properly look after my health, and just had a look at how much of my time is spent doing that. And it's huge. It's like half of a full-time job. The amount of time.
Half of a full-time job.
Just to attend appointments.
Yeah.
And we've been talking at this conference about lots of ways to reduce the wasted time. And so much of that time is logistics. It's making appointments, it's waiting for them, it's travelling to them, and it's trying to get your information when you need it. And then also taking all this time to prepare for an appointment because you're not sure whether that specialist is going to have the information from the other specialist.
Right.
We've got a big problem in Australia with people not feeding data into the systems that we have to try and link everything together. So heaps of wasted time and energy on trying to be an advocate for yourself.
What made you go back and create this pie chart of your time in the first place? Like, what was it that really was the impetus to do that? Because, I mean, it's not, we're talking like you just looked at a week. You looked at it was like a 9-year span, right? Like it was almost a decade worth of diary hunting and categorizing to create this chart. So what prompted you to do this?
Yeah. The main thing that prompted me to do it was, firstly, I was second-guessing myself at work about, asking for reasonable accommodations, which was mostly, I shouldn't say simply, because it's not very simple always to accommodate people's needs, but was to try and flex around work time and work hours to attend these appointments. And I thought, I can't really be that busy. Like, surely I'm just not organised enough or whatever. So I went back and looked at it. But the main impetus for actually creating the pie chart was being asked to present at a telehealth conference.
Okay.
So the situation in Australia is we're a huge country and we're working towards providing more consults via video call to reduce travel.
Sure.
So, people that live, 10 hours away from hospital, why should they have to travel for something when no one needs to touch them? But there's no funding to provide telehealth services to people who live in metro areas.
Really?
Yeah. So it still might take me 45 minutes really to travel to the hospital, park, get inside the building. Both ways, so you can add 3 hours, to your day just for travel for an appointment when you live close by. But doctors aren't paid by Medicare to provide telehealth treatments to metro patients.
That's ridiculous.
So
oh my God, okay.
I'm getting involved in policy to try and change that. So I was presenting to convince health service managers that it's important.
How did it go?
Yeah, I think it went really well.
Yeah.
Only in that afterwards people came up to me and said, I have actually been restricting access to things like allied health professionals here. Doctors can't charge for telehealth appointments, but the billing's different for us. So as a physio, it makes no consequence to me at all whether or not I see someone in a clinic or via telehealth in terms of billing.
Okay.
For most things. So when people were restricting access, saying, people were saying to me, you're not eligible for telehealth appointments. You live too close, like you can drive. They don't ask for special treatment. And I want to say, look, I've had 3 appointments this week. I have a full-time job and a family. Just make things more convenient to me.
Right.
Because at the same time, there is, a big belief that many patients don't take care of their own health properly and don't take responsibility. We're supposed to exercise and eat well. But if we're just too busy going to all these appointments, how can we do it?
Absolutely. There's just only so many hours in a day. I think that's so interesting. Your point about telehealth, I wasn't aware of that limitation in metro areas. That's just such a different model. So you're advocating for that more convenient use, and also, it was interesting to me when we were chatting earlier that in your actual day job, part of what you've done, one of the projects you worked on was on a platform that was looking to enroll patients in clinical trials. And it just misunderstood the patient so badly. So tell me again about that experience.
Yeah, well, we started what's called the Stroke Research Register, and it literally is a contact list of people who have had a stroke in the Hunter region, in Newcastle, who were happy enough to be in different types of clinical trials.
Okay.
And we started it because, the last trial that ran that prompted, Coralie English, who's my boss in that role, to get going with it. The last trial that prompted that took 2 years to enrol 19 patients who needed to come and sit down and chat to a researcher for 2 long days, but it required 2 days of sitting around doing nothing.
Oh my gosh.
It took 2 years, and there's 600 people who present to the hospital where it ran with a stroke every year. There's no lack of people.
Right.
But we really weren't connecting with people, because why wouldn't they want to help someone else in the future, or people who enroll in clinical trials? There's research to support that they end up getting better medical care overall. So we've created this platform and made ourselves more accessible and tried to really address the power imbalance that exists between health professionals and researchers. Just not that people think that they're more important than somebody else, but the system creates this power imbalance, right?
Right, it does.
And we're connecting with people, and we're including them in trial design and asking for people's feedback and opinions and their lived experience expertise to inform what we do.
Last thoughts from you, Gillian, on that creating equity in the health system between the people who are delivering care and the people who are receiving it. What's your view on that? How do we do that? How do we create equity?
Yeah, that's a huge question,
isn't it? That's why we're going to end on it.
Yeah. I think one of the ways that we can create equity is to make health services and to make even processes where we're trying to involve consumers in design of things, we can do it properly and make it accessible. And by accessible, I don't just mean that you've got ramps and handrails and good lighting. You should have that. But the way that we deal with people should be from an equal respect point of view. Mm-hmm. We need to do things like cover people's costs so that the only people that can be involved in research aren't people who have enough money to do it. Yep. So we need a variety of voices, and processes need to be made more simple and use plain language and value people's expertise. So by saying plain language, I don't mean dumb things down.
Right.
I mean give people all of the information, but we don't need to package it with research terminology.
Yeah, that nobody understands, or acronyms. That's my pet peeve in healthcare, is all of the acronyms. Yeah. Gillian, it's such a pleasure to speak with you and get the patient perspective here in Australia. Thank you so much, and thanks for sharing your story with us. Appreciate it. I'm Jessica DeMassa with WTF Health here at the HISA studio. Thanks so much for watching.